So you're about to deliver this fancy screw retained crown for your patient, and you try it in, you check the occlusion, it's perfect. You check the contacts, not so perfect, maybe an open contact on the distal. Now you need to send it back to the lab for them to add some ceramic, but how do you communicate with the lab how much of an open contact there is? So for this patient, we see in the mouth that the open contact is in the distal. So what I'm going to do is I'm going to use a sharp 15 blade and I'm going to gently scrape this as to how much it's open in the mouth, right? Crown back in, and then we see, okay, there's an open contact here as well, and it's similar to what's in the mouth, and therefore the lab should be able to work with this. I would always say probably trim about 10% more so that the lab adds a little bit excess, and then you can trim that back and fit it into place and get a nice tight contact. But if you go just exactly right with the amount you trim, you may still end up with an open contact, and that's going to be very frustrating. So that's one way of communicating to the lab about how much of an open contact you have on your crown. Of course, it's not super accurate, it's pretty arbitrary, but it is better than nothing. It's better than calling your lab and saying, hey, add a little bit of ceramic, add a lot of ceramic. You need to quantify those values. Stay tuned for the next video where I teach you another technique on how to communicate this to the lab. I hope I've confused you enough. This is the Dental Review Guy signing off with a smile.